I'm making this video to ask for help. I am the victim of what I call a predator, except in my case this predator was a reputable doctor at the time I met her. After 4 years of being my doctor, she started an affair with me. There was in fact a lawsuit. In addition to that, there were OPMC charges, which is the Department of Health, Office of Medical Professional Conduct. It's been 2 years. My life has been ruined. I have suffered with emotional and psychiatric problems since I'm 14, which has been well documented. This doctor was aware of it. I have no support system. I have no family. And this doctor just started showering me with attention, and before I knew what was happening, I was involved. According to the AMA, a doctor is never supposed to enter into any kind of relationship with a patient, be it a friendship. They're not supposed to even have lunch with a patient unless there's a medical reason for it. I have 250 text messages from Dr. Jane Schlecker. I have various amounts of emails. I have 20 voicemails, and that's only because my phone only held 20 voicemails. They've been authenticated by a third party that gets paid to do that. Professing her love for me, telling me she never wants to go back to a life without me in it. She was married. She had full-grown children. I guess her husband either always knew that she was involved with me, but on what level I don't know. And he eventually had become aware that it was more than just a friendship, and gave her an ultimatum and told her that if she doesn't stop having the affair or seeing me, period, she had to choose between him and her family or myself, which I could understand, even though it turned me into a broken belief. I was heartbroken, but when she had given me his ultimatum and told me what her excuse was, her words when I said to her, "Jane, you told me if I put my heart in your hands, you'd never hurt me," and she said, "Well, I never thought I would, but I am." Throughout the course of our relationship, me being on disability and her being a doctor, and her husband is also a doctor, she actually works for him, and I showered her with gifts, took her to Broadway shows, front row seats, hired car service to treat, because I wanted to treat her like this princess. I didn't think she should have to drive because she spent so much of her time driving, whether it was driving herself around. Her husband claims to have a fear of bridges and tunnels and highways, so anytime they had to go anywhere, she did the driving. Taking her kids, friends home. Could have been 2 o'clock in the morning. Some other parents said, "Well, we can't go pick up our kid, can you do it?" And as much as she had to be up and ready to go to work at 5 in the morning, she would be out there driving, playing, taxi cab. I don't think anyone appreciated her except for me during the course of our relationship, and I'm the one that got eaten up, spit out, and left for dead. I kind of reference it to the nursery rhyme, or Humpty Dumpty fell off the wall, and all the king's horses and all the king's men couldn't put Humpty together again. In my case, Humpty Dumpty didn't fall off the wall. Humpty Dumpty was pushed off the wall. She is a sociopath. Everything she did was deliberate. She knows how to pick her prey. They go after a vulnerable person, and by the time you know you're their victim, it's kind of too late to turn back. had been suicidal and homicidal for the past 2 years, because I feel I don't have anything left to live for. Again, it's not just that the relationship ended, it's how it ended. She also had me arrested for something I never did. Yeah, I prevailed. The case was dismissed, but I was put through being arrested for something I never said or did. From what I understand, as we are reaching the 2-year mark since the relationship ended, she continually goes to the police and tries to have me arrested. I got a call as recent as 3 weeks ago from a detective saying that someone made a report that I was trying to kill them and that he wanted to arrest me. Why am I doing this video now? Several reasons. OPMC finally came down with what they call a punishment. There's a flyer that I've made up. Inside the flyer, taken off the OPMC website, is where it says, I don't know if this is going to be able to be read. I'm doing my best here. This is the first video I've ever done. I'm probably better off reading where it says factual allegations. It says, respondent treated patient A at her private office in Brooklyn, New York between 2004 and 2010. Beginning in or around 2009, on more than one occasion, respondent engaged in inappropriate contact with patient A. The front page says that the physician was given probation for 3 years. In the body of the conditions of the probation, which there were 12 conditions, they are mandating her respondent, number 10. That's where my finger is. Let's see if I can put it on the camera. Respondent shall engage and continue in therapy with the treating care professional. Thereafter, therapist respondent shall cause the therapist to submit a proposed treatment plan and quarterly reports to OPMC certifying whether respondent is compliant with the treatment plan. OPMC, at its discretion, may provide information or documentation from its investigation files concerning respondent to respondent's therapist. The therapist shall report to OPMC immediately if respondent leaves treatment against medical device. Number 11 is respondent shall enroll in and successfully complete a continuing education program in the area of appropriate physician-patient boundaries and medical ethics. This week in Brooklyn, New York, which was where I'm from, there was a doctor that was part of a big fraud ring that they busted, and it was several doctors, but one of the doctors is someone who had previously been sanctioned by OPMC with probation. I'm not sure if it was a 2 or 3 year probation, and during the whole time he was on probation he was continuing to do this accident type fraud thing, getting referrals from lawyers, basically robbing insurance companies. And it goes to show you that although OPMC is an agency that was put in place to protect the public from bad doctors, they in reality do the exact opposite. The only reason this doctor, Jane Schlecker, that abused me, exploited me emotionally, sexually, took advantage of me, got away with as small a penalty as she did, is because of what they have known as plea bargaining. They give the doctor a chance to bargain down the charges that are against them for a lesser charge in lieu of going to a hearing, which would be more costly, of course, and possibly losing their license. So this allows them to keep their license, go on to possibly hurt someone else, in some instances kill someone else. There are doctors that have gone into the OR, doctors that are impaired, doctors that have taken off the wrong limb, doctors that just shouldn't be practicing medicine that get a slap on the wrist, and it's not until another 1, 2, 3, or 5 other incidents happen. And when I say other incidents, it's only if people are even aware that there is an agency they can go to file a complaint that something may or may not be done. I know of doctors that have caused the death of children because of their negligence and or incompetence. A simple tonsillectomy where the child was bleeding from the throat and brought to the doctor, where the doctor thought nothing of it, and the child died from being septic from swallowing his own blood. Medication errors. There's 98,000 deaths a year due to medical errors that could have been avoided. Many of them are exactly that, they're errors, it happens, and many of them are just because the healthcare provider is incompetent, should not be practicing. In many of those instances, reports were made to OPMC about an egregious action on their part or something incompetent or negligent, and they get away with this, what I consider a slap on the wrist, so they're free to go out and do it again. My opinion is doctors have a license to kill and get away with it. Again, I'm begging for help. I think both the doctor that did this to me needs to be exposed. I think OPMC and their policies need to be both changed and exposed, and if not now, when? This week in particular, as I said, it's made the news twice, and not only was the news coverage about the doctors that got busted, it was about how poor the system at OPMC is for monitoring these doctors. You put them on probation, but what are you doing in that 2 or 3 years they're on probation if they're still out there committing the same infraction they committed from the get-go? You don't want this to happen to you. You don't want this to happen to your family. You don't want your son or daughter to be that child that's going to have a tooth extraction, and while under anesthesia, his genitals are touched by the doctor. You don't want to be that female that goes to your GYN doctor and gets an inappropriate examination. You may already be one of those people that was either afraid to come forward, believing that no one would believe you. After all, the doctor has an MD, and who are you? They're going to more than likely believe the doctor without any kind of concrete proof. But if people come together, if this is something that is brought out in the newspapers that can get people together and start lobbying in Albany for reform, people supporting each other and coming forward, you'd be surprised if, like in Penn State with this coach, someone came forward and all of a sudden, going as far back as 10 years ago, there are children that are now children coming forward that, yeah, this happened to me. So once people start talking, you might find that other patients went to the very same doctor that might have abused you, did something inappropriate, touched you the wrong way, your child, your mother, your wife, whomever, appealing to anyone that watches this video to please think about the seriousness of it. Doctors are people that are in a higher position of power, and they need to follow really strict guidelines, more so than myself or most people that might be watching this video, or most patients that go to the doctor. And when they fail to do that, it's very serious. And I can only now speak for myself. I know what this has done to my life. I know I haven't been able to get over it. It's going on 2 years. Yes, I've been to therapy. There's very few there are no support groups for anyone that I'm aware of that has been, as an adult, sexually abused by an adult. They have a plethora of support groups for adult survivors of childhood abuse. This is something I'm now living through as an adult, and I also was a victim of childhood abuse, and I guess that makes it worse, and this doctor also had that knowledge. Looking for an editor, a publisher, other patients to come forward. Any comments that anybody might have, any suggestions that anyone might have, are all welcome. Thank you. My name is Michelle.